A baby died in Havana last night, not because of a rare disease, not because of medical error, because the lights went out and the doctors could not see. If you have ever trusted a hospital to keep someone you love alive, stay with me, because what is happening in Cuba right now is not just a Cuban story. It is a warning. For 65 years, Cuba's government survived on one argument. You can criticize the politics, you can criticize the prisons, but you cannot criticize the healthcare. The infant mortality rate was lower than parts of the United States. Life expectancy rivaled Western Europe. Cuba exported doctors to dozens of countries as living proof that the revolution worked. Critics had opinions, Cuba had numbers, and for 6 decades the numbers won every argument. The number is 14 now. Hit the like button if you want more people to see what that number actually means. 14 babies dying for every 1,000 born in Havana. 5 years ago, that number was 4. 4 per 1,000 placed Cuba alongside Canada, the United Kingdom, and parts of Western Europe. That number was not just a statistic. It was the moral foundation of the entire regime. The one thing the government could point to and say, whatever else you think of us, we keep children alive. 14 per 1,000 destroys that foundation completely, not gradually, not partially, completely. And here is the part the headlines are not telling you. 14 is the number the government chose to admit. In a system with total control over data collection and publication, the real number is almost certainly worse. 14 is what they decided was acceptable to reveal. The actual figure lives in the maternity wards no journalist has entered and in the deaths that were never recorded as infant mortality at all. Morin Echevarria Pinena is 26 years old. She is 9 months pregnant. She has gestational diabetes and hypertension. She was admitted to a maternity ward in central Havana 3 weeks before her due date, so her doctors could monitor her condition. The hospital's backup generator ran out of diesel. The lights went out. When her contractions begin, the doctors will deliver her child by the light of their cell phones. She told reporters she is terrified of what happens when labor starts. She is not alone. Another expectant mother named Indira is due to deliver her daughter Anoa next month. She told the BBC, "I keep picturing myself in labor in a dark room. What if something goes wrong and they cannot see?" These are not exceptional cases. These are not rare tragedies that made the news because they were unusual. This is the standard of care in Havana right now. Hospitals across the capital and Santiago de Cuba are operating without reliable electricity for days at a stretch. The power grid collapsed in October after Hurricane Oscar knocked out Cuba's largest power plant. Engineers restored partial service. The grid has been unstable ever since. Rolling blackouts hit residential areas for 18 to 20 hours a day, and the priority circuits that were supposed to protect hospitals have failed. Even critical medical infrastructure is going dark. Cubans call it the new normal. For a woman about to give birth, there is nothing normal about delivering in a room where the doctors are guessing at what they cannot see. Here is what the infant mortality collapse actually requires to understand. Neonatal intensive care units need 3 things without interruption: electricity, clean water, temperature control. Cuba's hospitals can no longer guarantee any of them. Incubators for premature babies need constant power to maintain stable temperatures. When electricity cuts out, temperatures inside incubators drop within minutes. Medical staff have begun wrapping infants in blankets and using hot water bottles to maintain body heat. That is a technique from the 19th century being deployed in a country that spent decades boasting about 21st century health outcomes. An obstetrician at a Havana hospital told the New York Times on condition of anonymity, "We are short on antibiotics, on basic medicine, on equipment. Food shortages mean we are seeing more underweight pregnant mothers, which means more underweight newborns, and we cannot keep the lights on. The food crisis compounds everything. The regime acknowledged in January that domestic agricultural production had fallen to its lowest level since the economic collapse of the 1990s. Pregnant women are arriving at hospitals already anemic, with inadequate prenatal nutrition. Their babies are being born smaller and weaker, requiring the intensive care that the hospitals can no longer provide. Comment right now and tell me, did you know any of this before this video? Because the disconnect between how big this story is and how little coverage it is getting is exactly the problem. Medical staff are making decisions that no training prepares you for. Which patients get the limited generator power, neonatal units or operating rooms, ventilators for adults, or incubators for newborns? One nurse told the New York Times that staff sometimes pool their own personal money to buy black market diesel for the hospital's backup generator. Doctors funding their own hospital's electricity out of pocket. That is not a healthcare system under stress. That is a healthcare system that has ceased to function as a system. Some hospitals have started scheduling cesarean sections only during daylight hours when natural light can supplement whatever power is available. Emergency interventions require transferring patients to facilities with more reliable generators. That requires ambulances with fuel. Fuel is also in short supply. Now here is the part that should disturb you far beyond the current crisis. And this is the loop most coverage never closes. Cuba's healthcare system survived on 3 external lifelines. All 3 have been severed simultaneously. The first was Venezuelan oil. For 20 years, Caracas sent subsidized crude that kept Cuba's grid running and its hospitals lit. Venezuela's own production has collapsed. The oil is gone. The second was medical tourism revenue. Cuba earned hard currency by sending doctors abroad and treating foreign patients at internationally competitive prices. Those programs have largely ended. The revenue that subsidized hospital operations disappeared with them. The third lifeline was the doctors themselves. Nearly 500,000 Cubans have left the island since 2021, 5% of the entire population in 4 years. Among them, significant numbers of healthcare workers. Doctors, nurses, technicians, the people trained to run the system, are leaving because the system no longer functions. The exodus creates the very shortage it is fleeing from. The average age of remaining Cuban physicians is now over 50. Medical school enrollment has dropped 30% since 2020. Students see no future in a profession where you cannot keep the lights on. This is the part that separates a crisis from a catastrophe. Even if the power grid is fully restored tomorrow, even if fuel shipments resume at full capacity, the people who knew how to run the system are gone. Infrastructure can be rebuilt. A generation of trained medical professionals cannot be replaced in a decade. Cuba is not just losing its present healthcare capacity, it is losing its future capacity. And the gap between the two grows wider every single month. The regime's response has not changed in 65 years. Every failure is blamed externally. Every crisis belongs to someone else. President Diaz-Canel addressed the healthcare collapse in a televised speech and called it a direct consequence of the genocidal blockade imposed by the United States. No mention of energy mismanagement. No mention of decades of underinvestment. No mention of the decision to build an entire economy around a single foreign oil supplier with no contingency plan. The U.S. embargo is real. Its impact is real, but it is not the only cause. And a government that cannot distinguish between what was done to it and what it did to itself has lost the capacity to fix anything. Washington's response has been to point at the exemptions. The U.S. embargo contains specific carve-outs for medicine and medical equipment. What Cuba cannot easily obtain is fuel. And that shortage exists because the regime made itself dependent on a single supplier for decades and built no alternative. The State Department says the root cause is Cuba's mismanagement of its economy and energy infrastructure. That is also partially true. Both governments are offering a half-truth and calling it the complete story. And between those two half-truths, women are delivering children in the dark. Here is what I want to say directly, because most coverage of this story never gets here. This is not a healthcare crisis. It is the collapse of the last legitimate justification for Cuba's political system. The revolution promised three things: sovereignty, equality, healthcare. Sovereignty is abstract. Equality is debatable. Healthcare was measurable. You could count the infant deaths. You could compare the numbers to other countries. You could hold them up and say, whatever else this system is, it keeps children alive. 14 per thousand ends that argument. Not partially. Completely. The one metric the Cuban government could point to as proof the system worked has now become proof that the system has failed. And it has failed not through external pressure alone, but through a combination of external pressure, internal mismanagement, and a structural dependency on foreign patrons who are no longer there. Cuba survived the economic collapse of the 1990s when GDP contracted 35% and hunger gripped the island. But Fidel Castro had revolutionary legitimacy, and the healthcare system still worked. The sacrifice had a justification. The narrative held. Diaz-Canel has neither revolutionary legitimacy nor a functioning healthcare system. The narrative has no foundation. The sacrifice has no justification. And the 14 babies per thousand who do not survive their first year are not abstractions in a geopolitical debate. They are the evidence that the last pillar holding up the story has fallen. We know infant mortality in Havana has reached 14 per thousand, triple what it was 5 years ago. We know hospitals are operating without reliable power, and doctors are delivering babies by cell phone light. We know medical staff are pooling personal money to buy black market diesel. We know pregnant women are arriving malnourished, and their babies are being born smaller and weaker. We know 500,000 Cubans have left since 2021, including significant numbers of healthcare workers. We know medical school enrollment has dropped 30%. We know Venezuela can no longer supply oil. We know the embargo exempts medicine, but not fuel. We know both governments blame each other exclusively, and neither account is complete. What we do not know is how many more mothers will deliver in the dark before someone decides this matters more than politics. What we do not know is whether the doctors who remain will stay long enough to train the next generation before the system collapses beyond recovery. What we do not know is whether a government whose last legitimate achievement has been destroyed can survive the moment its own people fully understand what that destruction means. Every government tells a story about itself to justify its existence. Cuba's story was healthcare. The infant mortality rate was the proof. The proof is gone. What remains is a woman in a dark hospital room in Havana waiting for contractions, hoping the doctors can see. That is what 14 per thousand looks like. Not as a statistic, as a person. We analyze this situation daily. Every number that changes, every development the headlines skip, we cover it here. If this video showed you something that the mainstream coverage is not touching, share it right now with one person who needs to see it. That single share reaches someone the algorithm never will. Here is my question for the comments. Is there a version of this story where both governments are partially responsible and neither will admit it? Or does the accountability belong entirely to one side? I want to hear from people who have studied Cuba, people who have family there, and people who are watching this story for the very first time. The comment section here has become one of the most substantive conversations on Cuba anywhere online, and I want that to continue. If you are not subscribed yet, now is the time. What happens next in Cuba will unfold in the coming months, and the developments will move fast. Subscribe so you are here when they do. I will see you in the next one. stay informed.